I am Dr. Nadeem Sajjad Raja. You are watching my YouTube channel, Dr. Raja Nadeem Sajjad Official. Please do subscribe my channel and press bell icon button. Today I'm going to talk about scabies. Scabies is very common in the underdeveloped world as well as developed world. It is an itchy skin condition which is caused by a mite, which is called as Sarcoptes scabiei. It burrows the skin and intense itching occurs in the area where the mite burrows. It is basically, the urge to scratch the skin is very high during night time. This is a contagious disease which runs among the family due to the physical contact or child care group, school class, nursing home, as well as the prison. It is so contagious, the doctors usually suggest treating whole family all together to just get rid of this skin condition. Scabies is a treatable disease, and after appropriate treatment, this disease is cured, even among the whole family. But one more thing, please always bear in the mind but you may still have some sort of itching for several weeks even after the treatment. So what are the signs and symptoms of the scabies? Itching, often severe, usually worse during nighttime, thin, irregular burrow tracks made up of tiny blisters or bumps on your skin. The burrows or tracks typically appear in folds of skin. They can be found on any part of the body in adults or children. But the most common or affected parts are between the fingers, in the armpit, around the waist, along the inside of the wrists, on the inner elbows, on the soles of feet, around the breast, around the male genital area, on the buttocks, as well as on the knees. In small children or younger children, the most affected areas are scalp, palms of the hand, soles of the feet. If you have already suffered with the scabies, after the exposure, the signs and symptoms appear within a few days. But if you never had a scabies, after the exposure, it can take up to 6 weeks for signs and symptoms to begin. Scabies is caused by the Sarcoptes scabiei. Female Sarcoptes scabiei burrows just beneath your skin and makes a tunnel where it deposits eggs. The eggs hatch and the mite larvae work on the way to the surface of your skin where they mature and can spread to the other areas to other people as well. So itching is actually the allergic reaction to the mites as well as their eggs and their waste. So there are the complications of this scabies. Because of the intense itching and vigorous itching, there are chances of secondary bacterial infections. For example, Staphylococcus or Streptococci, they cause impetigo, sometimes superficial skin infections. But these infections can lead into the severe infections. For example, cellulitis, that is also a serious infection of the skin. One another infection that is called as necrotizing fasciitis, that is caused by a toxin producing bacteria, for example, Staphylococcus as well as Streptococcus. Scabies could be severe in elderly patients or patients who are immunocompromised. For example, if they are taking any immunosuppressive drugs or they are suffering with HIV. So that condition is called as a crusted scabies or Norwegian scabies. So this could be very severe, and specifically we see in very ill patients or hospitalized patients, and also we see the outbreaks of Norwegian scabies in the hospitals. Even in my hospitals, I have seen two outbreaks, and we managed those outbreaks. The diagnosis is usually based on the basis of the clinical picture. Your doctor will examine you and then will check your skin, will find the burrows, specifically between the fingers, groin areas, under the armpits, around your waist where you tie up your belt. Then after that, because it's very straightforward, so after that, the doctor might take skin scrapings from the tunnel area, from the burrows areas, and then will send to the laboratory. So they will check under the microscope, they will check the Sarcoptes scabii. After the confirmation of the scabies on the basis of the clinical picture as well as the laboratory report, then doctor will decide to treat the patient, and usually they treat whole family, or if for example it is in the nursery, then they will suggest treating all babies and also the nursery staff, and as well as if there is a ward is infected in the hospital, so they suggest usually treating the whole ward at the same time. So doctors suggest to apply cream or lotion on your whole body from the neck down and leave the medication for at least 10 hours. So some treatment require second application, some require 5 applications. Then following day, they suggest taking bath with warm water. After completion of the treatment, wash all your belongings. I mean, whatever is being used, pillowcases, duvet covers, bed sheets. This is the only way to get rid of scabies. I am going to mention a few medication, but please do not use without consulting medical practitioner. For example, permethrin cream is used. Ivermectin is also used. Urex croton cream is used. And if there is a secondary bacterial infection, then doctor will prescribe some antibiotics to treat the bacterial infection. Now we talk about the prevention, how we can prevent scabies. Before going into the prevention, itching is really a problem. So this itching can be resolved by taking antihistamine tablets or applying some soothing lotion on your skin, and specifically it is quite intense during night time. So antihistamines before going into the bed will definitely help. Okay, let's talk about the prevention. Prevention is very important. So receive treatment, apply the lotion or cream advised by the doctor to whole family. That is the best way to get rid of scabies. The other thing is wash all linen. As for example, if you can't wash any of your clothes or anything, just put into the bag and leave for a few days. Then this itch mite will starve and definitely will die. If you have any question, please write down in the comments and I will reply. Thank you for watching this video.